Now we will discuss about the topic Digeau's syndrome. Digeau's syndrome is typically due to the deletion of 30 to 40 genes in the middle of chromosome 22 at a location known as 22q11.2. About 90% of the cases occur due to a new mutation during early development, while 10% are inherited. It is autosomal dominant, meaning that only one affected chromosome is needed for the condition to occur. Diagnosis is suspected based on the symptoms and confirmed by genetic testing. Although there is no cure, treatment can improve symptoms. This often includes a multidisciplinary approach with efforts to improve the function of the potentially many organ systems involved. Long-term outcomes depend on the symptoms present and the severity of the heart and immune system problems. With the treatment, life expectancy may be normal. Digeau's syndrome occurs in about 1 in 4,000 people. The syndrome was first described in 1968 by American physician Angelo DiGeorge. In late 1981, the underlying genetics were determined. Causes of Digeau's syndrome. Digeau's syndrome results from the deletion of the 22q11.2 segment in one of the two copies of chromosomes 22. It affects approximately 30 to 40 genes. Many of these genes are not yet fully understood. The syndrome usually starts as a random event during fertilization, either on the maternal and paternal side. It may happen during the time of fetal development. Most cases are not inherited and there is rarely a family history of the condition. However, in around 10% of cases, it is passed from a parent to a child. Symptoms of Digeau's syndrome. A symptom is something felt or experienced, such as pain or dizziness. Signs and symptoms are not mutually exclusive. For example, a subjective feeling of fever can be noted as sign by using a thermometer that registers a high reading. The CDC lists various diseases by their signs and symptoms, such as for measles, which include a high fever, conjunctivitis and cough, followed a few days later by the measles rash. Treatment. Treatment depends on the organ system involved. It can involve a wide range of health professionals. This include pediatricians, cardiologists, geneticists, immunologists, infectious disease specialists, endocrinologists, surgeons, therapists. Different conditions caused by Digeau's syndrome need different type of treatment. Other treatments include cleft palate. Surgical repair is usually necessary. Heart defects, surgical repair may be needed. Development, physiotherapy, educational and language support are some example of help that is available. Mental health care. Some mental health disorders may require treatment depending on the diagnosis. Thank you.